The basics of stroke. Stroke is defined as damage to the brain due to a clot or hemorrhaging, in which the blood flow goes and fills ventricles and tissues in the brain. Another synonym of stroke could be a brain attack. Similar to a heart attack, this means that the brain is about to die. So, one more synonym for a stroke is a cerebral vascular accident, CVA. And if the symptoms last just minutes or hours, much less than 24 hours, it could be that the person is having a transient ischemic attack, TIA. It's a warning sign of a possible future stroke, sometimes called a mini stroke. But you have to be aware that 10% of people who have a TIA will have an actual stroke within 3 months. So, if a person has a stroke, let's get a person right here, front and center. What are the symptoms that they're experiencing? Well, the first one might be a sudden and severe headache. It really hurts. It's uncommonly painful. There might be trouble seeing in one or both eyes. There is a sense of dizziness, a sense of confusion. I just call this wobbliness. The person has trouble walking. And they also have trouble speaking. They can't seem to get their mouth and their tongue to work as it usually does. And another thing that the stroke will cause will be some numbness or weakness in various parts of the body. And that might be, for example, in the face. One arm might feel weak or even numb, or it might be a leg. Now, what's going to happen is if the damage is on the, as you look at it, on the left side of the body, the symptoms are going to be on the right side of the body, below where the brain stem switches sides. So, if you've got a right-sided stroke, the symptoms are going to be on the lower left-hand side. So we'll get a right. So they cross. Now, if somebody has a stroke, they have come up with an acronym to get people to take action, and that acronym is called FAST. We've already talked about the face. Ask the person to smile. If it doesn't seem to work right, ask them to raise their arms. And if they're able to raise them symmetrically, they're okay. If not, they're not okay. The S stands for speech. Ask the person to speak a simple sentence. If, when they speak that simple sentence, they are not able to be understood, if their speech essentially seems slow, it is now time to call 911. Now they got having a stroke because they had risk factors often, and so these risk factors are divided into risk factors that you can't change, not able to change them, or the risk factors that you are able to change. Let's look at some of those that you're not able to change first. And these would be age. As you get older, your risk of stroke increases. How about gender? Well, this is very sensitive for women because Stroke kills more than twice as many American women every year than even breast cancer. So it's a significant mortality situation for women. Also, more women die from stroke than men die from stroke. So we've got that particular fact. So the risk for stroke is higher for women due to a higher life expectancy, but even worse, women have greater risks of disability after stroke than men do. Final risk factor that I'd like to mention is that of race. And I'll put an equation here. African Americans have twice the risk of stroke as Caucasians. Also, they have twice the risk of death as Caucasians. So that's a pretty heavy-duty risk. Now, those are the things you can't change. What can you change? Well, you can change your weight. You can change if you've got increased blood pressure, hypertension, you can work with your doctor to bring that blood pressure down. If you smoke, stop. If you're a heavy alcohol drinker, you need to reduce that habit. If you've got atrial fibrillation, you need to work with your doctor on changing the bad effects of that irregular heartbeat. And if you've got high cholesterol, you need to take dietary or medication to make sure that that doesn't put you at increased risk for stroke. Now, you want to know if you have a stroke, what is the diagnostic procedure? And that would be a CAT scan. It's a tunnel. You'll be placed on a table. Your head would go through the tunnel, sliding into the tunnel, and x-rays would be beamed at your head, passing through your head, your brain, and being detected, sensed on the other side of the machine. And essentially, the images made depend on the absorption of the beam by the tissue it passes through, so that when it comes to your brain, we'll go back to our head up here, and your brain, if, well, the skull is white because that's bone, and the x-rays are absorbed by that. The ventricles show up in the CAT scan as being dark areas because air and water absorb very little of the x-rays, so that looks black. And essentially, the rest of the brain is going to look gray. So here we've got a normal brain. We've got it's essentially black, white, and gray. So if you have a stroke, you will notice a change on the CAT scan. If it's a thrombotic stroke, you will actually see a darker gray. So this is a darker gray, showing the death of brain tissue where it's less dense. If you've had a hemorrhagic stroke where there's been bleeding into the brain, essentially what you will get will be a white area. So where there should be gray, there's now white. And what can you do about all this very bad situation? When it comes to stroke, you can look at your risk factors and see if there's anything that needs to be changed in your lifestyle. So look at this particular profile of increased risks and see if you can change that.